Hello, student. Which response?
Yes, ma'am.
The slides are visible.
Yes, ma'am. It's visible.
Okay. रश्मि से जो ये टाको स्लाइड टाको अनम्यूट कर देबा माने विजिबल ये टाको काइना हम केतले बही देखि करबा वन ଆଉ ତାର ବି ଆଉ ବହୁତ ଗୁଡ଼ାଏ ଖୋଲିଗଲା ଗଥର ବୋଲି କେତେ ଜଣ 11 ଜଣ ଏ ଓଟିରେ କାମ now slides are visible. Hello student.
Yes, ma'am. Yes, ma'am. It's visible.
Okay,
Yes, ma'am.
now we will start regarding the nervous system. 32, the block BNS 032. Okay, 032 का जो नर्वस सिस्टम का है आज का टॉपिक नर्वस सिस्टम का ओके now we will start regarding the unconsciousness first topic is unconsciousness okay now I will start hello hello students
Yes, ma'am.
yes okay all you know that myself P. Lakshmi Bai, Associate Professor, Medical Surgical Nursing, College of Nursing, Barampur. Now, what is unconsciousness? Okay, the brain requires a constant supply of oxygenated blood and a glucose to function. Interruption of this supply will cause loss of consciousness within a few seconds and a permanent brain damage in minutes. Okay, if the brain requires a sufficient amount of oxygen and blood supply, glucose level if it will be happen then the automatically the function will be normally done if it is any type of interruption occurs then of this supply will cause the loss of consciousness within a few seconds and that may lead to permanent brain damage okay within 1 minute or within few minutes okay then meaning of the consciousness it is a state of that has a three important aspects one is awakefulness second one is awareness of self and third one is awareness of the environment and time these three things awakefulness awareness of self and awareness of the environment and time if these things are absent then that stage is known as a unconscious or it may lead to unconsciousness then review of the anatomy and anatomy of the brain okay all you know that in the anatomy physiology the first stage that is a first year topic nursing foundation anatomy physiology all you know that any system if you will go then first we discuss the regarding the anatomy okay review of anatomy of the brain first is brain divided into four parts. First is cerebrum, second is dicephalon, third is brainstem, fourth one is a cerebellum. Okay. Then cerebrum. Cerebrum divided into two parts. One is cerebral cortex and another is a corpus callosum and diencephalon is second part that belongs to thalamus, pineal body, and hypothalamus. Okay, then brainstem belongs to midbrain, pons, and medulla oblongata. Then third one, fourth one is a cerebellum. This is a total picture. The picture is like that: cerebrum, cerebral cortex, and a corpus callosum. Okay, this part is a corpus callosum. Then cerebral cortex. This is a all total cerebral cortex. Then second one is a diencephalon, thalamus. Thalamus is the inner part. Thalamus. Okay, look at the picture. Thalamus. This part is a thalamus. Then pineal body. Okay, pineal body. Pineal body. This inner side, pineal body, and a hypothalamus. This one is a hypothalamus. Okay, this part is a hypothalamus. Then comes to brainstem. This is a brainstem. The brainstem belongs to midbrain. Okay, midbrain, medulla oblongata. This part is a medulla oblongata, and a pons. This is a pons. Okay, this part is a pons, and medulla oblongata. Then last one is a cerebellum. This is all total cerebellum. Okay, this is the structure of the brain. Next, all you follow. Then next comes to reticular activating system. Reticular activating system, RAS, reticular activating system. Then specialized sensory tract. Okay, specialized sensory tract, that is example spinothalamic, auditory, visual, etc. Then spinothalamic, again spinal reticular tract, and a collateral fibers. That two are combined, the spinal cord. Then that leads to reticular formation, and reticular formation, then cerebral cortex. Okay, it is leads to cerebral cortex. Cerebral cortex is the perception of the consciousness. The perception of the consciousness, mainly cerebral cortex, that form the reticular formation. Reticular formation mainly spinal cord, the area, the spinal cord area that form the reticular formation, mainly spinothalamic. The spinothalamic specialized sensory tract, auditory, visual, spinal reticular tract, and a collateral fibers. These are the two things combined to form the spinal cord. Okay, spinal cord, then after reticular formation, and reticular formation, cerebral cortex, and that leads to perception of the consciousness. Okay, then reticular activating system, all total picture given, thalamus and reticular projections, then pineal glands and cerebrum, the whole total visual images, and a pons, reticular formation, medulla oblongata, spinal cord, so somatic sensory impulses from the apparent to efferent. Total area, the picturize the reticular activating system. Okay, then meaning of the unconsciousness. Hello student, hello students, it is visible, the slides are visible.
Yes, ma'am. Yes, ma'am. It's visible.
Okay, okay. Meaning of unconsciousness. Meaning of unconsciousness. Unconsciousness implies that that is a stage of depressed cerebral function. If the cerebral function is depressed, then human become unconsciousness. That result impairment in response to sensory stimuli. Okay, impairment of the in response to sensory stimuli. Sensory stimuli mainly leads to loss of self-awareness or a surroundings or environment. and it is a onset in both sudden and a gradual. The process is onset both suddenly, then after gradually. Okay. Then next comes to definition of unconsciousness. Unconsciousness is a state in which unable to respond to people and activity. Unable to respond to people and activity. Lacking awareness and the capacity for sensory perception. Temporarily lacking unconsciousness. Okay. Then next comes to without conscious control, not awareness of one's action, behavior, etc., and lacking normal sensory awareness of the environment without conscious volitions, and unconsciousness can be brief, lasting for a few seconds to an hour or a few hours to longer. This is about the unconsciousness meaning. Then it is an abnormal state. Okay, unconsciousness is an abnormal state resulting from the disturbances of sensory perception. Disturbances of the sensory perception to the extent that the patient is not aware of what is happening around him. Okay, period may be momentary or maybe last for the month, for a few momentary, or it may be last for a few months, also for a month. Then the levels of unconsciousness. Okay, levels of unconsciousness mainly excitatory, stuporous, fainting, somnolent, coma, and vegetative states. Okay, these are the stages, levels of unconsciousness. First is excitatory, stuporous, fainting, somnolent, coma, and a vegetative stage. One by one we will discuss. Then excitatory unconsciousness means does not respond coherently, but it disturbed by sensory stimuli such as a bright light, noise. That is the characteristics of excitatory unconsciousness. Does the respond only coherently respond, but the patient disturbed by sensory stimuli such as a bright light or a noise. Okay. Then second one is a stupor. In stupor, patient responds to external stimuli. Okay, patient responds to external stimuli and shows the symptoms of annoyance when stimulated by pin prick or the loud noise such as a clapping. Okay, that is a patient's stupor. Only she or he responds the external stimuli and shows the symptoms. Okay, that is known as a stuporous stage of unconsciousness. Then third one is fainting. Okay, fainting. In fainting, there is a momentary loss of the consciousness, and the patient usually recovers spontaneously. Momentary loss of consciousness, and automatically they became recovered spontaneously. That is known as a third stage unconsciousness type. Then fourth one is somnolent. Somnolent is state when the patient feels drowsy or sleepy, or we can say it is a state between the sleeping and awaking. Okay. Then next comes to coma. Coma is a clinical state of unconsciousness in which the patient is unaware of himself and his environment. The patient may respond to sleep painfully, stimuli in deep coma, and there is no arousal. Okay, there is no arousal. That is a coma stage. Unconsciousness coma stage is a clinical state of unconsciousness in which the patient is unaware. He is himself as well as his environment also. The patient may respond to deep painful stimuli, any type of deep painful stimuli in the sternum or in the pinna, any type of stimuli given to the patient, then the patient may respond to deep painful stimuli in coma, deep coma, and there is no arousal. Okay, that stage is known as a coma. Then vegetative stage. It is defined as a clinical condition of complete unawareness of cell and environment with damage to the CNS, central nervous system, totally damaged in this stage and no chances to recovery. That stage is a unconscious stage, that is known as a vegetative stage. Vegetative stage, clinical condition is completely unawareness of cell as well as their surrounding environment. Okay, then comes to etiology. Etiology, unconsciousness etiology, structural lesions, any type of structural lesion in the brain cell, some supratentorial lesion. Okay, in the brain, supratentorial lesions, any type of lesion present in the supratentorial area causing brainstem dysfunction. Okay, causing brainstem dysfunction. That is example, epidural hematoma, subdural hematoma, or brain abscess, or cerebral infraction. Any type of these examples are present, or this type of abscess, brain abscess, or a cerebral infraction present, then the structural lesions occurs, structural lesion. Then brain dura matter, subdura hematoma, and arachnoid matter, like picture pie matter. These are the different layers of the brain, the structural showing the picture. Okay, total layers, 3 layers. Etiology mainly first is structural lesion. If any structural lesion present, that may be epidural hematoma or subdural hematoma, brain abscess, and cerebral infraction. समझो क्लास चलती डिसिशन क्लास ऊपर स्किल आवे. Okay, then comes to etiology continue, that is cerebral hemorrhage and a brain tumor. If the patient having a cerebral hemorrhage, any type of cerebral infection in the brain cell, then the cerebral hemorrhage occurs, then any type of brain tumor. It is also one of the cause unconsciousness. Then next subtentorial lesion, compressing or destroying the reticular formation, and a cerebral abscess. Example, cerebral abscess. And cerebral abscess, if the cerebral, this is a picture of the cerebrum. Okay, this is cerebrum. The abscess will be present inside the cerebrum. This is the picture of the cerebrum. Cerebral infraction, cerebral hemorrhage, or a tumor. It is the one of the cause of unconsciousness. Then metabolic disorders and a diffuse lesions. Okay, metabolic disorder or a diffuse lesion. Diabetic coma. In case of diabetic coma, cellular starvation, ketone bodies formation. Then in case of hepatic coma, accumulation of the waste product in the systemic circulation. Then fluid and electrolyte imbalance, sodium and osmolar imbalance in CNS, central nervous system, or nutritional deficiency, any type of anorexia or ischemia, and partial oxygen that is less than 25 Hg, or a disease of the neuron, lesions of the motor neuron, any disease of the neuron, that example, lesions of the motor neurons. These are all the causes of the unconsciousness. It may be hepatic coma, or it may be diabetic coma, or a fluid electrolyte imbalance and a nutritional deficiency, anorexia, or ischemia. These are the all causes of unconsciousness of a patient. Then consciousness concussion and a post postictal state. Concussion that is a when a head injury occurs, temporary jerking of the brain, and that may lead to concussion. Contusion is one of the type of temporary basis brain jerking, and a drug overdose. Drugs overdose, that is sedatives or analgesic or alcohol, and decrease HR, BP, respiratory tract temperature. That is also one of the cause. And anesthetic agents, if it is overdose of anesthetic agent, or UTI, RTI, psychogenic causes, these are all the causes of unconsciousness. Okay. Then pathophysiology of unconsciousness, mainly structural lesion, that subdural hematoma, cerebral hemorrhage. These are all the causes of structural lesions. And then that leads to damage to the brain and skull. Primary injury, any type of primary injury, or edema, inflammation, and hemorrhage secondary, and that increase the ICP. Okay, intracranial pressure increases, and hours to days, and that leads to diffuse damage to the cerebrum, and the calcium potassium levels also, that brain stem, that is also totally imbalanced. Then disturbance of the reticular activating system, that leads to unconsciousness. Okay, these are all pathophysiology of unconsciousness. Then metabolic disorder and a diffuse lesions. Okay, if the patient having a metabolic disorder, that leads to respiratory disorder, that leads to liver and a kidney disorder, that leads to neurological disorder. If the patient having a respiratory disorder, then decrease the oxygen concentration, that leads to cerebral hypoxia, and that leads to cerebral hypoxia when the partial oxygen less than 25 mm of Hg. Then next, that leads to impairment of the CNS cell function. Then that disruption of the cerebral function, that leads to disruption of the in reticular activating system, that leads to patient having unconscious. Then next, metabolic disorder and a diffuse lesion in the liver, kidney disease. Then that leads to decreased blood sugar, and a sodium osmolar imbalance occurs. Then that leads to cerebral hypoglycemia, and that leads to impairment in the CNS cell function, and that leads to disruption in the cerebral function and disruption of the reticular activating system, that leads to patient become unconscious. In neurological disease, that is also cause unconsciousness. The neurological disorder leads to decreased blood supply to the brain tissue. Then that leads to cerebral ischemia. Okay, cerebral ischemia, that leads to impairment in the CNS system, cells functions, central nervous system cell function, that leads to disruption in cerebral function, and that leads to disruption in the reticular activating system, and the patient became unconscious. This is the metabolic disorder and a diffuse lesions. Okay, this is all about the pathophysiology of metabolic disorders. Then diabetic coma. In case of diabetic coma, then decrease the insulin, that leads to cell are unable to generate energy from glucose. Okay, then that leads to cellular starvation, Then that leads to metabolism of stored fat and a protein. That leads to formation fatty acids, and that leads to ketone bodies formation, and that leads to accumulation of the butyrate and acetone acetic acid, and that leads to offset pH balance and a metabolic acidosis, and leads to that leads to develop the reticular activity also impaired, and that leads to totally patient having coma stage. Okay. Then hepatic coma, interruption of the portal vein circulation or the disruption of the metabolism. Then that leads to accumulation of the waste product in the systemic circulation. Okay, NH3. Then NH3 cross the blood-brain barrier. Then that leads to absorbed and metabolized by astrocytes. Then that leads to formation of the glutamine and increase the osmotic pressure, and that leads to brain edema and a decreased energy supply to the brain cell. That leads to alter the LOC, level of consciousness, that leads to coma. Okay, hepatic. These are all regarding the pathophysiology of brain unconsciousness. Then clinical manifestation of unconscious patient. What are the clinical manifestation? Hello student. Anyone from the group? Tell. Clinical manifestation. What are the clinical manifestations seen in the unconscious patient? Hello. Hello. Hello students. Hello students.
Madam,
हाँ.
observe sign or symptoms.
Clinical manifestation. हाँ, sign and symptoms. Clinical manifestation. What are the clinical manifestations seen in the unconscious patient? कौन कौन देखा जीवो? पेशेंट अनकॉन्शियस हे गला, कौन देखा जीवो?
Madam,
Okay, we will discuss. Okay. First is stridor. In respiratory system रे stridor माने गोटे घ घ हे कि respiration टा respiration abnormal respiration गुडा का जानी थिबो साउंड केमती होथो काई ना तांकर प्रॉपर्ली respiratory system चालुनी हेले कोन गोटे जमी गला परी, that is stridors. Okay, rails, rocci, ये सब that these are the abnormal respiratory sounds. Okay, and progressive cyanosis. Okay, whole total body क्यों respiratory माने oxygen is less, deficit in the unconscious patient. Then progressive cyanosis, the patient ro progressive cyanosis, chain strokes, respiration टा कौन होबो chain stroke. Okay, asymmetrical chest wall movement also asymmetrical. Symmetrical hele normal and asymmetrical chest wall, and decreased respiratory rate, decreased depth, and depth upore decrease the respiratory rate and depth. Okay, these are the respiratory clinical feature. Okay. Then next, cardiovascular systems. Cardiovascular system, bradycardia, hypotension, ventricular tachycardia, atrial fibrillation, hyperkalemia, arrhythmia, decreased cardiac output. These are the cardiac system clinical feature. Bradycardia, hypotension, ventricular tachycardia, atrial fibrillation, hyperkalemia, arrhythmia, decreased cardiac output. Okay. Then next, neurological system. Okay, neurological system, seizure is one of them. Seizure, lethargy, unequal pupillary dilation. Okay, absent deep tendon and reflexes, absent those eye reflexes. Astraxia, myoclonus, seizures. These are the clinical features in the neurological system. Then gastrointestinal system, due to distortion of the CN, that is 10th cranial vagus nerve. Okay, 10th cranial nerve, that is vagus nerve function. Then abdominal distension, decreased bowel sounds, constipation, ascites, hyperlipidemia. Okay, all are remember due to 10th distortion of the 10th cranial nerve, vagus nerve. 10th cranial nerve is known as a vagus nerve. Function, abdominal distension, decrease bowel sounds, constipation, ascites, and a hyperlipidemia. Okay. Then urinary incontinence. Okay, high creatinine index, oliguria, ketonuria, UTI, and a pyuria. These are the clinical features in the urinary system. Okay, then diagnostic evaluation mainly Glasgow Coma Scale, GCS. Okay, assessing the neurological assessment function by using the Glasgow Coma Scale, GCS. Scoring range 3 to 15. 3 is the lowest score and 15 is the highest score. Abnormal less than 10, normal more than 10. Okay, these are the findings. Then best verbal response, best motor response. Okay, these are the components of the GCS. First is eye opening. Spontaneously, patient became open the eye. Then the score is 4, and to speech, that is 3. To pain or any type of stimuli, that is 2. Do not open, then that is 1. Okay, total score is 4 to starting, and the lowest is 1. And best verbal response, if the patient is having oriented, then it may be 4, 8, 5, and confused stage, then it is 4. Inappropriate speech, that is 3. Incomprehensible sound, that is 2. Then no verbalization, that is 1. 1 score. Okay. Then last one is a motor response. Obey commands, that is 6. Okay, if the motor responses, if the patient having obey the command, then the score is 6, and a localized pain 5, and withdraws from the pain, that is 4. Abnormal flexion, that is decorticated posture, that is 3. And abnormal extension, decerebrate. Okay, decerebrate, that is known as a 2. The extension towards the uh, towards the body, extension. Okay, flexion towards the body and extension towards the body, that is a 3 and 2. And then no motor response, that is score is 1. Then collection of the history, unconscious the patient history collection is very important. What is the cause, why the patient is having unconscious? Voluntary movement strength, physical assessment, voluntary movement strength, and asymmetry in the upper extremities. Then deep tendon reflexes, biceps, triceps, and a patella. Then posture, cerebrate or decorticated. Okay, in the score, the GCS last 3 and 4 is decerebrate and decorticated. The posture, what posture patient showing, that is the assessment, decerebrated or decorticated. The total physical assessment, we collect the data. Then the picture like that: extension, posture, decerebrated, rigidity, and the patient having extended towards the body. Okay, extend towards the body, and flexion also, the decerebrated, decorticated, and decerebrated. These are the two pictures of unconscious patient motor response. Then second one is a brain stem. reflexes. Pupillary light reflex, corneal or a lash reflex, ocular reflex, oculocephalic reflex, doll's eye reflex, and oculovestibular reflex or a caloric testing. Then gag swallowing reflex. These are the some of the pictures. Corneal or a lashes reflex, small cotton swab we inserted side in the eye lashes. Okay, eye lashes reflex to know the eye reflex. And pupillary light reflex, assessing the pupillary size, symmetry, and a reaction to the light. Then next comes to reflex eye movement elicited by head turning. Okay, any type of turning or any type of things we are elicited towards the head turning, then we know the reflex eye movement. And absent eye close or indicates the compression of the cranial nerve, fifth trigeminal nerve. Okay, fifth cranial nerve is known as a trigeminal nerve, that indicates the compression, absent of the eye close. If the patient having a eye don't close, then the fifth cranial nerve, trigeminal nerve is a compress. It indicates compress the trigeminal nerve. Then oculocephalic reflex, doll's eye reflex, associated of cranial nerve, third, fourth, and this ocular reflex. Then oculovestibular reflex or caloric testing. Cranial nerve eighth, acoustic sense of equilibrium test of the vestibular portion, and a sense of hearing of the ocular portion. Hearing also tested, sense of hearing, ocular portion. Then gag swallowing reflex, assess the CN, cranial nerve, ninth glossopharyngeal, and 11th spinal accessory to evaluate the gag swallowing reflex. Then tongue protrusion and ability to handle the secretion, tongue protrusion and ability to handle the secretion, that is assess the ninth cranial nerve, glossopharyngeal, and 11th spinal accessory to evaluate the gag swallowing reflex. Okay. Then comes to diagnostic tests, CT scan, cerebral edema, infraction, hydrocephalus, and a shift of the any structural lesion. Okay, these are the all diagnostic tests. We know the structure, any lesion, or the it may be hydrocephalus, or it may be any infraction or cerebral edema. Okay, CT scan through. MRI through, we know the types of the tissue, tumors, vascular abnormalities, or a intracranial bleeding. Okay, types of tissue, then tumor, if the presence of tumor, or a vascular abnormalities, any type of vascular vessels abnormalities. Okay, vascular abnormalities, and a intracranial bleeding, any type of intracranial bleeding, we know the cases through MRI. Okay, then next comes to lumbar puncture, cerebral meningitis, CSF evaluation, or a hematological test, complete blood count, or a then level of the drugs in the blood, aspirin or a paracetamol, EEG, electrical activity of the cerebral cortex. These are all regarding the hematological test. Then comes to intracranial pressure, ICP, combined volume of the three intracranial compartments: blood, cerebrospinal fluid, brain tissue. Normal, the ICP is 5 to 15 mm Hg. Okay. Then management of unconscious patient. First is first aid. First aid is most important of the unconscious patient. The first aid is like the most important function of the first aid is ensure that the patient air passage remains open and clear. Then take note of any alteration in the state of unconsciousness, either improving or deteriorating. Then suppose if the patient is unresponsive, no breathing, only gasping, then activating the emergency response and get the defibrillator and check pulse, high quality CPR and improves a victim's chance of survival. Okay, this is all about the first aid methods. Then next comes to CPR. If the patient is unconscious, CPR is highly essential. Okay, okay. Then breast bone, sternum, and compression. The compression are performed between the two nipples and a left side. Then the critical characteristics of the high quality CPR including start compression within 10 seconds of recognition of the cardiac arrest. If the patient having cardiac arrest, we recognize. Push hard, push fast. Compress at a rate of 100 beats per minute. Okay, 100 beats per minute with a depth of at least 2 inches, that is 5 cm for adult, and children approximately 1 inch, approximately 1 inches, half, that is 4 cm for the infant. Allow complete chest recoil after each compression. Minimize interruption in the compression and give effective breaths that make the chest rise. Avoid excessive ventilation. Then begin cycles of 30 to 2. Okay, 30 compression and 2 breaths. This is about the critically characteristics of the high quality CPR. Cardiopulmonary resuscitation, CPR. Cardiopulmonary resuscitation. Then next defibrillator arrives. Okay. Then artificial defibrillator arrives. Check the rhythm. Then shock able to give one shock and resume CPR immediately for 2 minutes. If the rhythm not shockable or resume, then CPR immediately for 2 minutes and check rhythm every 2 minutes. Continuous ALS, advanced life support. Providers to take over and victims start to move. Okay, hospitalize, move to hospitalize. CPR revised guidelines. Compression, airway, breathing. CAB. Okay, CAB. Previously it ABC, but now the revised guidelines according to CPR. Compression, airway, breathing. Push at least 2 inches on adult breastbone and 100 times per minute. Okay, 100 times per minute to move the oxygenated blood to vital organs. That is compression. Then airway, open the airway and check for breathing or a blockage, any blockage or a watch for the rise of the chest and listen for airway movement. Listen for airway movement. Then next is breathing. Tilt chin back for the unobstructed passing of the air and give two breaths and resume the chest compression. Okay, two breaths. Then after chest compression, continue the chest compression. This is the new guidelines, CPR. Okay. Then medical management, the goal of the medical management are to preserve brain function and to prevent additional brain injury. First thing. Second thing is the primary focus is on maintaining the supply of oxygen and glucose to the brain cell and activating the brain cell. The patient circulation, airway and breathing must be maintained. Lastly, our goal is to manage the medical management, mainly focus on the brain function and prevent the additional injury, brain injury. Then primary focus is to maintain the supply of the oxygen and glucose to the brain. And last one is a circulation. Patient circulation, airway and breathing must be maintained. Then reverse common causes of the coma. Then the immediately intervention for the patient in a coma, including the treatment of common causes of coma for comatose patient who appears malnourished or a 1 week encephalopathy and may occur secondary to alcohol abuse. Okay, reverse coma causes coma. Then second one is the patient are commonly given thiamine for prevention, especially if they are given glucose. Then next point, if the patient is having a lorazepam, okay, repetitive seizure, coma and brain damage can follow. The patient IV diazepam or lorazepam to stop the seizure. Okay. Then next comes to if the patient is not intubated, closely monitor the airway because of these depressants effect of the medicines, and if the cerebral edema is present, osmotic diuretics, okay, osmotic diuretics may use to promote the shifting of the extracellular brain fluid back into the plasma. Okay. Then steroid barbiturate, neuromuscular blocking, and decrease the intracranial pressure. If the infection is suspected, the patient has a severing, then ICP increases. Okay. Use of vasoactive agents may be required to keep the systolic blood pressure at 100 mmHg or the mean systolic blood pressure above 80 mmHg. Promote the cerebral perfusion. Okay. These are regarding the medical management. Then moves to surgical management. Surgical management, decompressive surgery, removal of the skull any part. Then next allow the swollen or any part of swelling present in the brain to expand or without being squeezed. Okay. These are the surgical procedure. Then surgical management, craniotomy. Okay, craniotomy. It may be removal of the uh, small part of the skull and remove the hematoma. Then after it close. Okay, this is the craniotomy procedure. Okay. Then small borrow the skull hole, then brain tissue retracted, then stunt of the ventricle. Any stunt procedure also stunting the CSF drainage. Okay, CSF drainage. If the overload CSF, then it became damage the brain. So stunting, sorting, stunting the procedure apply CSF drainage. This is also surgical procedure of the brain. Then nursing management of unconscious patient. Nursing management, nursing diagnosis, ineffective airway clearance, related to inability to swallowing, and intervention airway management and oral airway can be inserted, and care of the endotracheal tube, tracheostomy, suctioning, positioning, and chest physiotherapy, nebulization. These are all nursing interventions required the management of the patient, unconscious patient. Then comes to risk for aspiration related to altered LOC, level of consciousness. Intervention, monitor ABG analysis, and keep the suctioning equipment available. Observe the cardiac monitor, dysarrhythmia, and a positioning the patient. Then next comes to impaired oral mucosa membrane related to mouth breathing, absence of pharyngeal reflex or a altered fluid intake. Then that intervention, inspect the patient's mouth every 8 hours. Apply water soluble lubricant to prevent the cracking and drying, and oral hygiene to avoid the parotitis, aspiration and RTI. Okay, oral. Uh, then comes to deficient fluid volume related to inability to take fluid by mouth. Intervention, accurate documentation of intake and output chart, and assessment and documentation of the conditions that might increase the fluid volume, deficit, diaphoresis, pyuria, and diarrhea, vomiting. Avoid overhydration or a patient receiving IV fluid because of risk of the cerebral edema. Then comes to imbalanced nutrition, less than body requirement related to inability to feed. Then intervention, IV fluids, nasogastric tube feeding, and maintain intake and output chart. Then risk for the injury related to decreased LOC, level of consciousness. Intervention, side rails, seizures, precautions, and use ହେଲା, seizures precautions, and use padded side rails. Keep the patient nails short and protect the patient head, and use any caution when moving, and always turn an unconscious patient towards you and someone that is else to prevent fall. Then do not restrain the patients unless absolutely necessary. If the restraints are used, and they must be released at least very 2 hourly for skin check. Avoid over sedation, which increase the ICP. Okay. Then do not leave the unattended. Impaired urinary tract elimination related to impairment in the neurological sensing and control. Intervention, catheterization, catheter care, maintaining aseptic technique, monitor urine color, then initiate bladder training as soon as the conscious regain. Then bowel incontinence related to changes in the nutritional delivery methods. And intervention, monitor the auscultate the bowel sounds and palpate lower abdomen for distension and maintain the food hygiene. These are all nursing intervention related to unconscious patient. Then immobility, integrity, the risk of the skin integrity related to immobility. Then the intervention, personal hygiene, skin care, care of the pressure points, and keep the nails trimmed, and read positioning every 2 hours, and put on the special mattress, or like air mattress, water mattress, or these are the different types of bed we will use regarding the immobility, skin integrity. This is all about the this is all about unconscious patient. Okay. Then after comes to CVA. All are listen. Hello, students. Hello.
Yes, ma'am. Yes.
This is all about the unconscious patient. The topic is next topic is CVA. All you know na CVA?
Cardiovascular attack.
Huh? What is that?
Cerebrovascular attack.
Cerebrovascular accident. Okay, CVA. You seen in the different wards also, the patient in a medical surgical ward and ICU patients. So many patients having a CVA condition. The age 45 to 55, 56, 57. Genetic people also affected, but the in age group mainly 56, 57, 54. Okay, you seen na? You have seen.
Yes, ma'am.
Okay. Okay, now start the CVA. Then the total, this is the blood circulation regarding the affected portion of the brain. The picture is, this is all about the brain structure. Okay. Brain, affected portion of the brain. This is the affected portion. The blood circulation is damage or the slowness, okay, the bluishness or discoloration. Then embolus, any type of embolus blockage or a blood flow to part of the brain. Okay, this is the blockage or any type of blockage embolus formation. Then internal carotid artery, the supply of the carotid artery, internal carotid artery. Then common carotid artery. This is a common carotid artery. Then one is internal carotid, another is a external carotid artery. Okay. Then embolus or a clot, any type of embolus or a clot in the aorta. Okay, this is a aorta. Okay, this is aorta. Picture you look. Then arterial fibrillation in the left atrium. Okay, this part is this is all total heart and a left side atrium, that may be arterial fibrillation occur. Then thrombus clot. Okay, this is a thrombus clot and heart. The picture is given. Okay, next, cerebrovascular accident. Objectives, after completion of the topic, the student will be able to know the cerebrovascular accident, definition of the cerebrovascular accident, explain about the risk factors of the CVA, and explain about the flowchart of the pathophysiology of CVA, and explain about the clinical manifestation of CVA, and list the differential diagnosis evaluation of the CVA, explain about the medical management of CVA, explain the surgical management, last one is a nursing management. Then cerebral vascular accident. Cerebrovascular accident or a stroke or a brain stroke, it is otherwise known as a stroke or a brain stroke, is the onset and persistence of the neurological dysfunction lasting longer than 24 hours and resulting from the disruption of the blood supply to the brain, and indicate the infection rather than the ischemia. Okay, any type of infection rather than ischemia. About 60% of the hemorrhagic stroke are result of the frontal or frontal cord tissue death. Then CVA, define the definition of the CVA. CVA refers to any functional or structural abnormality, of the brain causes by a pathological condition. Okay, any type of pathological condition that may be functional or a structural abnormality of the brain that causes CVA or the entire cerebrovascular system. Okay, entire cerebrovascular system. Then this pathology either causes hemorrhage from a tear in the vessels walls or the impairs the cerebral circulation by partial or a complete occlusion of the vessels lumen with a transient or the permanent effect. Okay. This is a part of the ischemia. Okay, this is a part of the ischemia. Then transient effect, ischemic area, the blood is not supplied properly, then the damage of the occur, ischemia occur. This is the vessels ruptured and a hemorrhage occurs. Okay. Then third most common cause of the death in the developed world. It is the third most cause of death in the developed world, CVA. Then common causes for physical disability in order to age. Then CVA denotes either ischemia from the occlusion of the blood vessel or a producing cerebral ischemia and infraction or hemorrhage through their ruptured. Incidence of the cerebrovascular accident. Then stroke facts. Okay, incidence that 7,30,000 new strokes and 3 lakhs affected in a TIA, transient ischemic attack, per year. Then out of that, 1,70,000 death per year. Then most common cause of the permanent disability. Patient became CVS, the patient became permanently disabled due to paralysis and all the brain function totally not function. Permanently they disabled. Okay. Then CVA is a leading cause of the adult disability in the world. Then worldwide, 1/4 of all strokes are fatal condition. Okay, serious condition, very fatal. And more than half of a million people in the United States experience a new or the recurrent stroke each year. Stroke kills about 1,50,000 Americans each year. 3 million Americans are currently permanently disabled from stroke. Then cerebrovascular accident occurs when there is a ischemia to a part of the brain or the hemorrhage into the brain that result in the death of the brain cell. Functions such as say movement, sensation or emotions that are controlled by the affected area of the brain that are lost or impaired. Okay, functions such as a movement, sensation or emotion that were controlled by the affected area of the brain that are the lost or impaired in these CVA cases. Then blood supply to the brain. Vertebral arteries from the, okay, whole total the picture is like that. The arteries from the subclavian and join at the lower border of the pons to form a basilar and a branches posterior cerebral, superior cerebellar, posterior inferior and a cerebellar anterior superior or a cerebral artery. These are the total artery branches to cerebral artery. They sit totally network like circle of wheel. Okay, you know the circle of wheel. Then comes to vertebral arteries from the subclavian joints at the lower border and points to form a bacillary branches posterior. Then circle of wheels. Hello students, circle of wheel means what is, which arteries are joined together? Anyone from the group? हेलो କେତେ ଜଣ ଜଏନ୍ ହେଇଛନ୍ତି ଜଣାପଡୁନି। हेलो अरे किए जॉइन ହେଇଛ କହୁନ କାହିଁକି? So what is circle of wheel?
Hello. Yes, ma'am. Madam, namaskar.
नमस्कार। ब्रेन ର स्ट्रक्चर रे सर्कल ऑफ व्हील गोटे अछि ना नहीं?
Again, ma'am.
What is that? Which artery or which vein they combine? Arteries are combined. Name the arteries.
Madam, cerebral arteries,
Very good. Cerebral arteries.
two cerebral arteries
Hmm.
connect to each other.
Hmm. देखो circle of wheels. Anastomosis of arteries at the base of the brain. Okay, anastomosis means joined together. Anastomosis of
Yes,
arteries
ma'am.
at the base of the brain permits the collateral circulation. Okay, permits the collateral circulation formed by six vessels. Six vessels. Okay, internal carotid, anterior and posterior cerebral, then next anterior communicating to posterior communicating 2 to 4, and internal carotid, internal anterior and posterior cerebral. This is all total 6 combined and permitting the collateral circulation and anastomosis of the arteries at the base of the brain. That is known as a circle of wheels. Okay. पिक्चर देखो। This is the circle of wheels. Circle of wheels. Okay. Anterior communicating arteries. Two posterior. Two posterior communicating arteries. Two posterior communicating arteries. Then internal carotid artery. Internal carotid artery. This one. Okay. Internal carotid artery. And this one is a anterior and posterior carotid artery. This is the wheel-like structure. Circle of wheel. Then major anatomical areas of the brain. Already you have know the in the previous class unconscious patient cerebrum. The cerebrum large part of the human brain consists of two hemispheres, that is left and right. Then left controls the majority of the function on the right side of the body, and right control the majority function on the left side of the body. Then B is that is composed of pairs of the different lobes: frontal, parietal, temporal, occipital. Then cerebellum. Cerebellum is the second part of the brain, and brain stem, final pathway responsible for a variety of the autonomic functions. Then all total picture of the brain and artery circulation. Frontal lobe responsible for movement, intelligence, behavior, memory. Okay, frontal lobe, movement, intelligence, behavior, and memory. Temporal lobe responsible for speech, behavior, memory, hearing, and vision. Then supra subarachnoid space. Okay, three space: durameter, subarachnoid space, outer is a skull, then scalp, then supraarachnoid space, then different arteries in the inside the brain. Okay, parietal lobe. This is all about the this pink color belongs to parietal lobe. Parietal lobe, this lobe is responsible intelligence, language, sensation, and a reading. Okay, this is the parietal lobe. Then this part is the totally the frontal part, movement, intelligence, behavior, and memory. Then occipital is a very small part only for the vision. Occipital lobe is responsible for vision. Then this is the violet color indicate the cerebellum. Okay, balance and coordination. Cerebellum, balance and coordination. Then the stem, brain stem. This is a brain stem. The breathing, blood pressure, heartbeat, swallowing, and a consciousness. This belongs to breathing, swallowing, heartbeat, blood pressure, and a consciousness. Okay, brain stem. Cerebellum, balance and coordination. This is all about the structure of the anatomy of the brain. The next, control centers of the brain. Okay, different lobe responsible for different work function. Okay, parietal lobe, comprehensive language. Temporal lobe, hearing. Occipital lobe, that is visual, primary visual. Then next comes to Wernicke's area, speech comprehension. Okay, then central sulcus. Okay, this is the central sulcus. Then sensory cortex, pain, heat, and other sensation. Then motor cortex, movement. Frontal lobe, that is judgment, foresight, and a voluntary movement, that is frontal lobe. Then Broca's area, speech for frontal lobe, smell, and a temporal lobe, intellectual and emotional function. This is all about the all total swallowing weakness. These are the brain stem. This is a cerebellum and this is a brain stem. Okay, different lobes responsible for different work and control the center of the brain. Then CVA is two causes. CVA mainly affect the two causes. One is ischemia, another is hemorrhagic. Ischemia occurs when the blood supply is interrupted or totally occluded. Then ischemia occurs. Hemorrhagic occurs from the rupture of the cerebral vessels. Any vessels ruptured, which causes bleeding into the brain tissue. Okay. Then ischemia mainly thrombus formation. Any type of thrombus formation or a clot formation in the brain artery. Okay. First one is a blood clot within the cerebral artery. Arteries are damaged by the atherosclerosis or a large vessel or a small vessel. Then second one is a ischemia due to embolus. Any clot originated elsewhere in the circulation. That is embolus. Then in the hemorrhagic intracranial hemorrhage, sub arachnoid hemorrhage. These are the two causes. Intracranial hemorrhage mainly parenchymal or the occur when the disease artery within the brain ruptured or a blooding, any type of blood of the surrounding tissue. Blood, if the blood surrounding tissue flooding the blood, it may be ruptured and or it may be flooding the surrounding brain tissue with blood. Then intracerebral hemorrhage occurs or a parenchymal damage. Then second one is a subarachnoid hemorrhage, bleeding into the skull or cranium. That occurs when the blood vessels on the surface or the brain ruptured and bleeds. it may be any type of. Okay. Mainly CVA causes two types: ischemia cause and hemorrhagic cause. Ischemia, thrombus or embolus, and hemorrhagic cause intracerebral hemorrhage or a subarachnoid hemorrhage. This is the picture about the hemorrhage and a aneurysm. Aneurysm is a thinning of the cerebral artery, breaking and open the causes bleeding around the brain, and a pressure of the blood on the brain causes the brain tissue damage, or any type of bleeding occur in the cerebral artery, and that became aneurysm, or the broken of the blockage and leakage of the arteries. Then upper picture, the mainly blood clot in the artery, cerebral artery, any type of clotting present in the blood clot present in the artery inside. These are the picture regarding the fat deposition. Okay, plaque formation, fat deposition in the intimal layer of the arteries, cerebral artery. Internal carotid artery, this is regarding internal carotid artery, and the clot formation in the cerebral artery. Any type of cerebral arteries, the clot is formed. Commonly carotid artery. Okay, this is all about the causes. Normal carotid artery and a plaque formation lining of the artery compressed due to blood dissecting off from the tear. This is all about clot. This is a clot. Then risk factors, non-modifiable factor and modifiable factor. Non-modifiable in severe non-modifiable factors, increasing age, being a male person are more affected, race, and a prior stroke, transient ischemic attack, hereditary cause. These are the non-modifiable. Okay. Then modifiable hypertension, heart disease, hyperlipidemia, diabetes mellitus, cigarette smoking, excessive alcohol intake, drug abuse. Then classification of the stroke: ischemic stroke, thrombotic, and embolic. Then second one, hemorrhagic, parenchymal, subarachnoid space. Onset and duration: transient ischemic attack, TIA, at least less than 30 seconds, but no more than 24 hours, with a complete resolution of symptoms. That is known as a transient ischemic attack, TIA. TIA, transient ischemic attack. Then stroke in the evolution: progressive development of the stroke over a period of hours and days. Completed stroke neurological deficit remains unchanged for a days to period. This is the picture of the cerebral hemorrhage inside the cerebrum. Then cerebral embolus, any clot in the arterial layer, and a cerebral thrombosis, or a plaque formation in the intimal layer of the arteries. Then classification of the stroke: ischemic stroke, thrombo, same things. Okay, picture: embolism, blood clot. All are look the picture: death of the brain tissue due to lack of blood supply. Okay, this part is death. Ischemia occurs due to blood supply less deficit. The discoloration of the brain tissue. This is the clot, embolism, blood clot. The picture look weakened or a disease of the blood vessels, and this part is ruptured. Okay, this part is aneurysm or a thinning of the blood artery layer, and it became ruptured, and the blood totally come out from the cells. Ischemic stroke. Ischemic stroke, inadequate blood flow to the brain from the partial or a complete occlusion of a artery. 85% of the all strokes is a ischemic, and 15% only remaining in the hemorrhagic. Okay, 85% ischemic stroke, inadequate blood flow to the brain from the partial or incomplete occlusion of the artery. 85% of all stroke. Symptoms may be progressive in the first 72 hours as an infraction or a cerebral edema. Then types of ischemic stroke, two types: thrombotic stroke and a embolic stroke. Okay, thrombotic and embolic. These are the two pictures. Then primary ischemic stroke, thrombus, obstruction due to hypertension, cardiac disease, hypercholesterol, atherosclerosis, embolus or debris detached from the flow and lodges in the artery. Arterial fibrillation, vascular valvular heart disease, cardiomyopathy, heart disease, air or a fat infectious fragments. These are primary ischemic stroke causes. Ischemic stroke, mainly ischemic stroke, blockage of the cerebral blood flow vessels, reduce the cerebral blood flow. Then ischemic hypoxia or a brain damage and disturbance in the glucose utilization, depletion of the ATP, depletion of the neurological neurotransmitter substance and a membrane, depolarization and a influx of the sodium and water and a calcium, release of the glutamine and a cell death. These are all regarding the ischemic stroke. Okay. Then cerebral hemorrhagic stroke commonly result from the hypertension, rapid bleeding into the brain tissue, and onset of the symptoms causes irritation and decrease ICP and leading to loss of the function of the neurological death. That is intracranial, intracerebral hemorrhagic stroke. Okay, this is all about the picture of the hemorrhagic epidural hematoma or subdural hematoma. Then this is the total hematoma, brain hemorrhage. Okay, inner side of the brain cell, that became hemorrhage. This is also picture regarding the hemorrhagic structure. Then subarachnoid bleeding into the subarachnoid space commonly result from the aneurysmal rupture, and a rapid onset of the symptom result in the severe sudden headache due to marked increase in the pressure around the brain, risk of the rebleeding, vasospasm, and a hydrocephalus. These are the conditions. This is about the picture of the subarachnoid space bleeding. Okay, these are the subarachnoid space bleeding. Very serious condition, subarachnoid space bleeding. Next comes to clinical manifestation, stroke recognition. 3 steps to stroke recognition. Ask the persons to smile and stick out the tongue. Then ask the persons to make the complete sensation. I can't fall. Tell side which one. Okay. This is about the 1, 2, 3. 3 signs. Ask the person to smile. if they stick out the tongue. Okay, they properly not smile. Then second one is the ask the person to make a complete sentence. They can't all tell side the which one. Okay, then third one, ask the person to raise both arms. Okay, not perform. These three things not perform, then we find out the clinical manifestation. Left side and right side. Right side damage. Right side damage result from the left side paralysis and a perceptual and a memory deficit, quick and a impulsive behavior. Then left side result from the right side paralysis. Then speech and a memory deficit, that's slow behavior. Then middle artery movement, contralateral weakness, hemiparesis, hemiplegia, loss of proprioception and a fine toss and a localized. And defect vision, blindness, right, left side, visual field, both sides. These are all different clinical feature according to their feature. Brain, brainstem occlusion or a contralateral weakness of the patients and urinary incontinence, sensory loss. These are the all regarding the clinical features seen in the cognitive impairment and personality changes. Okay, loss of spontaneity, loss of interest in the surrounding, apraxia, loss of ability to carry out the familiar familiar purposeful movement in the absence of the sensory and motor impairment. These are all clinical features involved in the anterior cerebral artery involvement. Then posterior cerebral artery and a vertebral vessel involvement. Altered the comatose, unilateral, bilateral sensory loss, and contralateral and bilateral weakness, dysarthria, dysphagia, hoarseness, ataxia, vertigo, unilateral hearing loss, visual disturbances. Okay, this is the motor, respiratory function, swallowing, speech, gag reflex. These are all the disruption motor neurons. Okay, patient having a motor neuron defect. Then right side brain and a left side damage. If the patient having a right side damage, then the left side problem arises, and left side brain damage, right side problem arises. All those totally impaired of the speech, language. If the left side affected, then right side showing, and right side affected brain, then left side, the opposite direction according to picture given. Then left CVA. Okay, left severe paralyzed right side hemiplegia, impaired speech and language, slow performance, visual deficit, awareness, depression, anxiety, impaired compression. Then right side paralyzed, exactly opposite side, right side severe, then paralyzed left side, hemiplegia, then special spa, spatial perception and tend to minimize the problem. Hand short attention span, visual deficit, impaired judgment, impulses impaired the time concept. Okay. Right cerebral hemiplegia controls the left side motor coordination. Then affected, difficulty controlling emotions, exerted or unpredicted emotional response, depression, feelings. These are the clinical features seen in the different types. So according to their right side and left side. Okay. Then into intellectual memory function, these are also markedly judgment, left side stroke, brain stroke, and right side brain stroke, impulses and movements quickly discern, difficulty in the learning skill. Then communicating, if the communicating artery affected, left hemisphere dominant, and a language skills. Okay, these are the receptive warning area surrounding speech and not more. These are all the clinical features regarding the according to their left side, right side, or any artery, communicating artery, posterior artery. There are losses are spoken or written, expressive aphasis, broadcast area, difficulty in speaking and writing. Then diagnostic evaluation. Severe diagnostic evaluation, ultrasound, carotid ultrasound, CT scan, MRI, CT angiograms, cerebral angiography, then carotid duplex scanning, blood investing, ECG, EEG. Okay, these are all investigation. Then different investigation pictures according to MRI. These are the pictures seen MRI. Okay, how the affected part is affected. And stroke management, mainly stroke management, then pre-hospital transport and management. Pre-hospital transport, facial drop and arm tripped and a speech. Airway potential problems, paralysis of the airway structure, vomiting, especially hemorrhagic stroke and a coma, seizure, cervical trauma as a patient collapse. Managing the airway, high flow oxygen. Have the person lie down and apply cold compression, use of the fan and elevate the feet, give the fluids. Then stroke management, breathing, potential problem, irregular respiratory, giant stroke, respiration, strokes, and a central neurogenic hypoventilation, paralysis of the muscles and respiratory. Okay, endotracheal intubation and high flow oxygen. Then stroke management, circulation. Okay, management is supportive and other treatment, IV assess and balance salt solution and a glucometer correct the hypoglycemia from transport of the patient in a higher setup where all the facilities are available. Then stroke management in the review, respiratory, cardiac, oxygen, ventilation, assess the neurological function, determine the precise time of the symptom onset, and determine the essential medical information, provide the rapid emergency transport to ED, emergency department, notify the ED department, and a possible stroke patient in the routine. Then comes to stroke management, door, ER trials. Okay, these are the all total. The door to doctor first sees the patient 10 minutes. Then within 25 minutes the CT scan completed. Within 45 minutes read the CT scan and then fibrinolytic therapy start within 60 seconds. Then neurological expertise available 15 minutes, neurological, all those facilities available within 3 hours, all total. Okay, then only the stroke patient is survived. Then stroke management, assess the ABC vitals, provide the oxygen, nasal cannula, obtain the, these are the all management. CT scan, perform the general neurological screening testing and obtain the 12 lead ECG, check the rhythm place of the monitor and oxygen, nasal cannula. These are all regarding the management of the stroke. Then stroke management, assessment, main goal is review the patient history, establish the symptoms onset and perform physical examination, perform the neurological examination. Okay, these are the all total management. Then stroke management decision, specific therapies, generally ABC, airway, breathing, circulation, and oxygen administration, treat the hypotension. If the patient having hypotension, treat the hypotension, avoid overhydration and monitor intake output chart. These are the general assessment. Consider the BP and consider the blood pressure. If the candidate having a fibrinolytic, then consider the response to initial effort to the lower BP and as well as the ischemic or hemorrhagic. Or treat the according to their blood pressure. We manage the patient. Then stroke management mainly decision different medication, oxygen, diuretics, barbiturate, neurological decompression. Okay. Then stroke total drugs, thrombolytic agent, fibrinolytic therapy, checklist, ischemia, and candidate neurological intervention. Okay. Age 18 years or old, acute signs of symptoms severe, and no contraindications. In stroke management, recently history taken, evidence of the cranial hemorrhage, then different activity, internal bleeding, or no, or a suspected pregnancy or a history stroke. All total, we are managed according to contraindication for the intervention therapy. Then stroke management contraindication for the intervention therapy. Patient comatose more than 85 years and a diabetic hemorrhagic condition and advanced liver. These are the stroke management contraindication of the fibrinolytic therapy. Then management prevention, drug therapy, surgical therapy, rehabilitation. Okay. Stroke management mainly thrombolytic agent, then anticoagulant therapy. These are the main therapy. Okay. Pre-printed disorder, severe neurological intervention, initial care and evaluation. This is the printed material. How to assess. Then prevention mainly healthy diet, health maintenance focus point of view, healthy diet, weight control, regular exercise, no smoking, limit alcohol consumptions, root health assessment. Then next is control of the risk factors. Then carotid surgical therapy, carotid endarterectomy, removal of the atheromatous lesion. Okay, and this is the one of the procedure, surgical procedure for the CVA patients. Aneurysm, if in the junction area of the two artery, then that must be correction. Clipping, berry aneurysm, fusiform aneurysm, biological or a synthetic warp, coiling of the aneurysm, warping of the aneurysm, clipping of the aneurysm. This is all about the picture. Surgical procedure. What is management? Nursing management mainly depend upon the risk for the prolonged bleeding. Okay, times related to use of the thrombolytic agents or anticoagulants and ineffective airway clearance related to inability to rise the secretion as evidenced by the advantageous breathing sound and ineffective cough. Impaired vessels communicating related to residual aphasia or the evidence by refusal or the inability to speak. Word finding problems in appropriate verbalization. These are the nursing management. Then ineffective tissue perfusion related to decreased cerebral blood flow. Then impaired physical mobility, impaired swallowing, and unilateral neglected related to visual field cut or a sensory impaired urinary elimination. These are all regarding the nursing diagnosis of the CVA patients. Then lastly, the conclusion regarding cerebrovascular accident occurs when there is a ischemia to a part of the brain or a hemorrhage into a brain that result in the death of the brain cells. This is all about the CVA. You all read entire topic CVA. Then after you know the what are the CVA and types of CVA, what are the investigation, how to identify the different clinical feature of CVA, and then after how to manage. Management mainly depend upon the three things. One is medical management, second is surgical management, third one is a nursing management. Okay, then prevention part. How to prevent? It will be preventable or not? Hello, student.
Yes, ma'am.
It will be preventable or not? Now two disease, one is unconscious, second one is a CVA. And third one start or not? Today it's a two diseases are more. No, you learn next class small disease like meningitis. What is meningitis?
Inflammation in meninges.
Huh. Inflammation and infection of the
Meninges.
meninges is known as a meningitis. Okay. Meningitis is one of the most terrifying disease. It can be fatal in hours. Okay, but it is a early symptoms resemble self-limiting condition like the flu and a colds. Total brain tissue, the outer covering. What is meningitis? Meningitis is the inflammation of the protective membrane. Okay, protective membrane covering the brain and a spinal cord. Brain and spinal cord. Okay, spinal cord also involved. Brain and spinal cord known as a collective as a meningitis. Meningitis is usually caused by a infection within the virus or with a bacteria. Okay, virus, bacteria, protozoa, any things. Bacterial meningitis, viral meningitis, you know na? Meningitis is the inflammation of the protective membranes covering of the brain and spinal cord. Covering of the brain and spinal cord known as collectively as a meningitis. Meningitis is usually caused by an infection with a virus with a bacteria. Okay. देखो total brain, central nervous system and spinal cord, the covering inflammation occurs. Meningitis. Okay. Then dura matter, arachnoid matter, pia matter. Okay, meningitis. Types of meningitis, viral meningitis. Okay, caused by virus, less severe, resolving without specific treatment within a week or a two. Also called as a aseptic meningitis, enterovirus family of virus, enterovirus. And second one is bacterial meningitis, caused by bacteria and a could severe and may result in the brain damage, hearing loss, and a learning disability. It could be also very cause of the death. Okay, these are the types. Then for a bacterial meningitis, it is also important to know which type of bacteria and is caused by the meningitis because of antibiotic and can prevent some types of spreading of infection. Microorganism and a peak incidence and a gram strain. Okay, इससे is E. coli. Okay, Escherichia coli. That peaks incidence is neonate and gram negative rods. Gram strain. Then Haemophilus influenza. Infants and children are more prone in this disease. Then gram negative cocci, coco bacilli. Then Neisseria and meningitis. Okay, meningitis. Then adolescent and young adults. Gram negative diplococci, streptococcus pneumonia, older adults and children more affected, and strain gram positive cocci in the chains. These are the common bacterial meningitis. These are all common bacterial meningitis. Bacterial meningitis. Okay, meningococcus meningitis, pneumococcus, then Haemophilus influenza type B, HIB. Okay, Haemophilus influenza type B, HIB. Okay, HIB. Then meningococcus, common organism that causes meningitis children and caused by the bacterial called the N meningitis. HIB. Okay, it caused Haemophilus bacteria and one of the deadliest childhood disease. Pneumococcus. It is caused by pneumococcus bacteria and which also several diseases of the respiratory system, including pneumonia. It has a fatalist rate of the about 20%. It also results in a higher incidence of the brain damage than the other forms of the disease. How do people get it? Okay, the most frequent cause of the meningitis is the entry of the microorganism from an infected elsewhere in the body through the brain into the cerebrospinal fluid. Then nasopharyngeal is common way implantation. The most frequent cause of the meningitis is entry of the microorganism infection elsewhere in the body. Okay. Then pathophysiology. Pathophysiology H influenza, then N meningitis, S pneumonia. Okay, these are the Staphylococcus pneumonia. These are the over 1 month of the age, nasopharyngeal and a implantation. Pathophysiology that is nasopharyngeal enter the cerebral blood flow and a ruptured vessel. Implantation wound, skull, fracture, surgery. These are the route of entry pathoorganism. Then after inflammation of the parenchyma and distribute to pyometer, arachnoid matter, subarachnoid space. Then behavioral changes, aggressive and a poor feeding, antibiotic therapy, hydration, ventilation, seizure, and resolution with or without impairment. And lastly, death depending on the age, type, onset, severity, and a response to therapy. Then fever, headache, these are the clinical feature and neurological changes, bulging of the frontal and photophobia, confusion, seizure, stupor, coma, and lastly cranial nerve palsy and a visual or a auditory impairment, hydrocephalus. These are the all. Then symptoms mainly vomiting, fever, headache, stiffness neck, photophobia, then drowsiness, joint pain, fitting. Okay, clinical signs of the meningeal irritation. Okay, conning sign, routing sign. These are the clinical features seen in the meningitis. Commonly in the clinical area you have seen. Then testing of the conning signs, flex one of the patient's leg at the both his hip and a knee, then straightening his knee. Okay. Then pain increase, resistance to the extension. Bruising sign, corning sign. You also know. Then diagnosis mainly LP, lumbar puncture. Contraindication in the respiratory distress positioning and ICP, increase ICP reported to increase the risk of the herniation and cellulitis. CSF gram strain, different strains also, gram strain, Haemophilus influenza, Streptococcus pneumonia, H flu. Completion of meningitis. Okay. Young children behavior changes and a forgetting recently learned skill. One of the most common problems resulting from the meningitis, hearing loss. Anyone who has to had a meningitis should have take a hearing test. Then reverting to bedwetting. Older people completion, lethargy, recurring headache, difficult in concentration, short-term memory loss, balance problem, clumsiness, depression. Serious complications, other serious complications including brain damage, epilepsy, changes in the sight. Treatment mainly bacterial treatment or a viral treatment, antiviral drugs and antibacterial drugs, antibiotics, okay, dexamethasone, control the cerebral edema. Then bacterial meningitis treatment, cefoxitinib 200 mg per kg per day or 50 mg per kg per dose IV 6 hourly. According to doctor's prescription, different antibiotics and vancomycin, these are the doses hourly, 6 hourly or 12 hourly given. Then supportive treatment, IV fluid, seizure precautions. Then next pain management and anti-leptic to prevent the seizures, monitor to reduce the intracranial tension, then antiemetic to reduce the vomiting, physical, speech and occupational therapy after severe encephalitis. Then vaccine for the pneumococcal polysaccharide vaccine recommended for the meningitis is recommended for all the persons over 65 years of age and younger persons at least 2 years old with certain chronic medical problems. Then prognosis untreated, then bacterial meningitis is the fatal condition. If early diagnosis and treatment, then it may be risk free. Then depend on the age of the patient and underlying cause. One of the newborn patients, 20 to 30% may die from an episodes of the bacterial meningitis. Then nursing care, all you know that level of consciousness, mental status, and muscle strengthening, headache severity, frequent neurological assessment done, then respiratory, maintain the pattern of airway, suctioning, and drainage secretion removal, monitoring oxygen, and give supplementary oxygen, and cyanosis, monitor the ABG. In nursing care, likewise other unconscious patient and CVA patients also take safety precaution, raise the bed rails and keep the bed in a low position, security net catheter, and keep room calm and quiet, carry out the need-based nursing intervention, limit the visitors, other sources of stimuli. Then provide emotional support and education, facilitate the communication, and arrange the social service consult. Bacterial meningitis, the picture of the bacterial meningitis, meningeal enhancement. in a bacterial meningitis through CT scan. This is the bacterial meningitis pus formation, pus covered surface of the meninges. These are the regarding the pus and the swollen of the total total meningeal area. Okay. Then next, abscess formation, cerebral city abscess. This is the bacterial meningitis. Abscess cerebral cross. MRI. Okay, thank you. Any doubt, student? Any doubt? Now 3 digits completed. One is unconscious, the second one is severe, third one is meningitis. Hello. ସବୁ ବନ୍ଦ କରିକି ବସିଗଲେ ବୋଧେ
No, ma'am. No, ma'am.
or rest GBS and head injury, you read any doubt, then you ask. Okay. In your
Okay, ma'am.
book, so many diseases is there in the neurological system. So CBA is a important disease. Then after head injury, then after meningitis. Okay, unconscious, how the unconscious patient is treated and what is the cause, you know. Okay.
Okay.
Yeah. Any
Thank
doubt?
you.
Ask. नहीं तो क्लोज करेंगे 5 ହେଇଗଲା नहीं बंद कर दे now we will stop.
Yes, ma'am.
Okay, thank you.
Thank you, ma'am.
ठीक है देखिए କେତେ long plan ଆସୁଛି ଧୀରେ ଧୀରେ ଛାଡୁଛନ୍ତି ଆଉ